Welcome to Mom Breaks. In this episode, we learn from the incredible work and experience of Dr. Diana Barnes, a psychotherapist and forensic expert specializing in women's reproductive mental health. For decades, she's worked with women and families through pregnancy, postpartum, trauma, grief, and perinatal mental health conditions like postpartum psychosis, helping shape how clinicians, hospitals, and the legal system understand maternal mental illness. She's a past president of Postpartum Support International and has advised California maternal mental health initiatives and continues to train healthcare professionals in perinatal mental health. She has served as an expert witness in criminal cases involving postpartum moms, helping courts understand the role that severe psychiatric illness can play after childbirth. In addition to her clinical and forensic work, Dr. Barnes has authored many books on women's reproductive mental health and has appeared in documentaries and national media covering postpartum mental illness. We do discuss several high-profile cases involving infanticide as a trigger warning. For those who are new to your work, can you share more about what you do?
Well, I've had a private clinical practice for over 30 years, specializing in women's mental health, but with a particular specialty in the reproductive years. So women's reproductive mental health across the lifespan. But I would say most of my patients are in that childbearing years. So my practice addresses things like perinatal mood and anxiety disorders, postpartum psychosis, trauma, pregnancy loss, infertility, anything having to do with the reproductive years.
How did that focus become clear for you?
Well, many of us go into this work with our own personal stories, and I am no different. My daughter is turning 34 this year, and after she was born, I suffered from very severe postpartum anxiety. And now we're going back to 1992. So you can imagine in 1992, there was no name. Nobody knew what was wrong. I saw countless therapists, psychiatrists, physicians, and nobody had a name for it. And by the time I even heard the word postpartum depression, I was a year postpartum. And so, just continued to relapse over the course of the next couple of years. And what should have now, we know, should be a relatively short course of treatment, maybe 12 to 16 weeks, was 3 years of battling an illness that had no name at that time. And I was just out of grad school becoming a therapist, and I never heard about postpartum depression in my studies. And so as I was recovering from 3 years of this just horrifying, experience, I realized that there were gaps, significant gaps, no systems of care in place, almost no, at least in my experience at that time, no specialized providers in my community, no support networks. And so I had just come out of grad school thinking, I have no idea what I'm going to do now with this degree. But upon the heels of my recovery, it became very clear to me what my destiny was. And so I opened up a practice in 1995, and I've been doing that work ever since.
Wow. Can you share more, do you mind, about that personal experience? What was so horrifying about it for you, and what language you were given as you were navigating it?
Well, there was no language that I was given.
Okay.
I don't remember, of course, now we're talking about quite a number of years ago. And of course, I've revisited my experience multiple times over the years, not only, sitting with women day in and day out who are experiencing perinatal mood disorders, but also in my forensic work and in training and teaching. I have revisited my experience many times. I think what was so horrifying was that I also came to motherhood, and my daughter is my second child. I'm realizing now, many years later, that I actually had postpartum anxiety with my firstborn, but I'm pretty high functioning. And so it was mild enough that I was able to somehow pull it together, literally, and move on without realizing what I had been experiencing, without realizing that that put me at risk for a more significant recurrence in a subsequent pregnancy and birth, without realizing any of the things that we've really come to understand now. I think what was so horrifying was that I came to motherhood buying into many of the myths that society tells us. You're going to love your baby. You're going to be sleep deprived, and that's not a problem. You're going to always be on top of everything.
Mm.
Overwhelmed, that's part of the job description. But I remember feeling so overwhelmed that I couldn't function
Mm.
and being told you're adjusting. I got a lot of that. You're adjusting, and that's the message that we often give new mothers is, of course you feel this way. You're adjusting without recognizing the distinctions between feeling overwhelmed and feeling like you can't cope. And I was unable to cope. My anxiety paralyzed me
Mm.
so that her cry, being in the room with her just brought such anxiety that I was literally in an immobilized state and I couldn't function.
Wow, that
And
sounds
I
really
think
hard.
that's what was the most terrifying part of all of this is not understanding what was happening to me. Even though I'm an educated person, I had access to resources.
Mm.
And yet, the people that I looked to for treatment, for understanding, just nobody knew.
Yeah. Yeah. I mean, that resonates with my own. Like I also had after this, my second child was my experience with postpartum psychosis. And afterwards I realized, you know what, like I was having some symptoms after my first as far as anxiety. And then also realizing like I had really high expectations for myself in mothering and like, oh, I'm just gonna fold in babies and keep operating on the same level and doing everything and more and Pinterest level birthday parties and like all of the supermom expectations that are
Yeah,
just unrealistic. So
yeah, yeah.
so you got into this through personal experience. It sounds like the timing was sort of perfect as you were wrapping grad school and becoming a mother. Can you share what it has been like? I'm curious, looking back into the 90s to today, how has the space evolved over the decades?
Well, it's evolved tremendously. I mean, we still have a lot of work to do, but I never even heard the word postpartum depression until I was a year postpartum. You know, that's a word we hear all the time now. There may be misunderstandings about it, what it looks like, how it manifests, but that word is now commonly used. Um, I never heard the word, you know, the advocacy that is going on, the support for women, completely different than what I experienced. I was kind of the lone wolf at that time, opening up a practice in an area that nobody spoke about or understood.
Yeah. Yeah. That sounds incredible that you were doing it. And I'm cheering you on in the past. I'm like, go, Dr. Barnes, like keep going. We need this. How did you, I guess, feel motive, like confidence and reassurance to keep pursuing as like there wasn't as awareness and following?
I think my own experience left me with this sense, and I've heard this from other women who have experienced postpartum depression in some form or another, that I didn't want any other woman to experience what I had
Mm.
experienced. It was just so horrifying to be that ill and not know what is happening to you and not having any understanding of that. I couldn't imagine any other woman going through that. And I think that was really the driving force behind just saying, this is what I'm doing now.
Yeah, that's fantastic. I feel that is one of the best motivating forces is serving other people and helping to improve others' lives?
I think I wanted to turn it around. I
Mm,
wanted to turn around the experience from something that was so devastating to something that brought some sense of hopefulness and optimism, if that makes
yeah.
any sense at all.
Yeah. Totally. Yes. So the question that I have next is would be absurd in if we were thinking back decades ago. How do we think about perinatal mood and anxiety disorders, specifically as we think about clinically assessing postpartum psychosis as opposed to others?
Well, postpartum psychosis is a completely different illness than other kinds of postpartum depression. And we know that postpartum depression can present itself in these varying forms, which makes it more complex in terms of diagnosis, makes it more nuanced.
Hmm.
Postpartum psychosis is a potentially life-threatening medical emergency that requires immediate medical attention. It's often misdiagnosed. It really constitutes a break with reality. And it's considered in the literature, they talk about it being a cognitive disorganization psychosis, complete confusion, cognitive disorganization, thought distortions, often characterized by either hallucinations. In my experience, certainly working in the forensic space, hallucinations are often, most often, either auditory and or visual. Delusions, which are false beliefs that are incontrovertible, regardless of any evidence to dispute them, and just a lot of confusion, mania, dissociation, agitation, restlessness, bizarre behaviors.
Yeah. Yeah. What are your thoughts on the DSM work around postpartum psychosis, knowing that there's sort of different flavors? So there's like depression with psychotic features or bipolar disorder. Like there's different ways that psychosis can occur. What are your
Well,
thoughts there?
you know, many of my colleagues agree because we've had these conversations that we need a section in the DSM that is specific to women's reproductive mental health. I know there is a lot of work going on in terms of getting postpartum psychosis into the DSM, and all I can say is it's about time.
Yeah, I was really encouraged when, I mean, we don't know for sure where things will land with the proposals for the
Right.
next DSM, but to hear that there are thoughts of having a postpartum specific chapter just feels phenomenal to me. I would be
Well, it
so
also
excited if it
affects
landed
me.
there.
It also affects me in terms of the forensic work that I do, because that comes up in the courtroom all the time that it doesn't exist, right? Because it's not in the DSM. And of course, we know that's foolish, that it does
Yeah.
exist. And there were many disorders and conditions that existed before they were in the DSM, post-traumatic stress disorder, right? That many, 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 many years ago, we started out by calling it shell shock, right? When the
Huh.
veterans were coming back from war. And it's
Yeah.
gone through many iterations, and it's even changed categories in the DSM. PTSD was originally categorized as an anxiety disorder in the DSM. And then I think it's DSM-5 when it was recategorized as a trauma and stressor related disorder
Okay.
based on the research.
I see. It makes sense that there's an evolution and a history of all sorts of categories of disorders, and we're certainly in the midst of postpartum psychosis getting like, where is it? Where does it fit? I would love to hear more about this work in forensic as an expert witness in
Yes,
forensic cases.
yes.
What do you wish prosecutors, judges, and forensic evaluators better understood about
Well,
PMADS?
I think the biggest dilemma and problem in terms of adjudicating these cases is that law and psychology are at odds with each other. There's a law called McNaughton, and that law basically says at the time that you committed this act, were you suffering from a mental disease or defect? If you were suffering from a mental disease or defect, As a result of that, were you able to appreciate kind of the nature and quality of your actions or the consequences of your actions? And or did you know that what you were doing was wrong? So McNaughton is basically the right and wrong test. Okay. Those of us in psychology know and understand very clearly that if you have a postpartum psychotic episode, you clearly do not know that what you were doing was wrong. Or if you did know that what you were doing was wrong, you felt some compulsion based on acute psychosis or altruism or whatever else. You felt some compulsion that was driving your behavior, a delusion of what we call delusion of control. Okay. But the law says, no, you could be psychotic and still know that what you were doing was wrong. And that creates a real dilemma. And because postpartum psychosis is not in the DSM, it complicates it even more.
Huh. So there's a law that says that you can be held accountable even if you didn't understand or you weren't in your right mind. What?
Yes.
That
More,
feels,
more or less, yes.
yeah, I'm not
I mean,
doing
it's a
full.
little bit more complicated and nuanced
Yeah.
than that, but that's the kind of nuts and bolts of it.
Wow. So then how do you navigate a system that's set up in that way?
Well, first of all, it's very challenging. And the kinds of cases that I've had over the years, I've stopped counting, but I've had somewhere, I started doing the forensic work in 2002. I've had over 100 cases
Wow.
in the last 24, 25 years. They're not all insanity cases, which makes it even more complex.
Okay.
And in the courtroom, you're kind of held to a standard of using the DSM in some way to substantiate your opinion. So, for example, postpartum psychosis might be thought of as a bipolar, which we do. We know there's a close connection between bipolar disorder and the onset of a psychotic episode postpartum. So I might language it as bipolar disorder with psychotic features, most recent episode manic or most recent episode depressed. But there are lots of different kinds of cases that find their way into the courtroom. It's not just postpartum psychosis. And I've had just a whole array of different kinds of cases over the years. I've had cases involving child abuse, causing either harm or death to a child. I've had cases, lots of cases of postpartum psychosis. I've had cases of what we're now calling unperceived pregnancy. It's a lack of recognition of the pregnant state, which ends in what we call neonaticide, which is the death of the child within 24 hours, usually by passive neglect of the mother. And that's a whole other conversation.
Yeah.
I've actually had cases where the birth of the baby was actually the catalyst for the onset of a mood disorder, but the baby was not the victim.
Okay. So other tragedies unrelated to
Someone
infant
else
or
was
stuff.
harmed, but the birth of the baby was the trigger for the onset of generally a psychotic episode.
Yeah. So how do you, coming in after the fact, take the details and discern what was going on?
It's really like trying to reconstruct what happened after it happened through review of records, looking at documents, looking at, what was her demeanor at the time of the arrest? What are some of the things she said? What are the medical, is there medical documentation? Is there a longstanding history of mental illness? So I'm really, pouring through documents and then talking to, this young woman who is now a defendant about what she was experiencing at the time. And it's interesting because I've often talked about the fact that there is a language to the way women talk about postpartum depression. There's a language that they use to describe their symptoms. And it's not unlike when we go to a physician and we say, look, I've got a headache and I've got chills and I've got a fever, I've got a sore throat. And your physician says, well, okay, this is what's going on, right? You've just talked about your symptoms. Well, in perinatal mood disorders, women talk about their symptoms by virtue of the language that they use to talk about it.
Huh.
So when women are describing their experiences, for example, what comes to mind is, the unperceived pregnancy, because that's become another kind of adjunct expertise of mine. When they talk about the dissociative experience, they use the same language. No matter who you're talking to, they use the same language over and over again to talk about their experience. And that becomes the symptom. And so that's what I talk about. And a lot of what goes on in the courtroom is
Hmm.
really educating, informing, because whether it's postpartum psychosis or unperceived pregnancies, there is still a lot of misunderstanding. We live in a space, you and I, where we talk about this all the time, and we
Hmm.
talk about it to people who understand, who are our, you know, there are allies in this work. But there is still a lot of misinformation, a lot of fear about these illnesses. And so, interestingly, in most of the cases, the majority, I'm educating about these illnesses as much as I am talking about what happened to this particular woman.
Okay. So for the situations where postpartum psychosis is feeling likely, what are the patterns and themes that you see in the woman as they're describing their experience? Is it the disconnect from reality, the delusions?
Yeah, the delusions of control, that feeling kind of on autopilot, robotic, not in control of their own actions. I've even, women often talk about as the voices began to emerge, trying to distract themselves from the voices that were so disturbing and frightening until the voices took over. So there really is a very specific way in which women talk about their experience. And much of it really is this sense of feeling robotic and out of control, no longer authority or agency over their own actions.
Oh, interesting. Yeah, because I've wondered since we know that suicide happens
Yeah.
and people can do things when they're in poor mental states, and you can do dumb things even without a mental illness, right?
Yes.
And so how do we like distinguish when someone is just like poorly making poor decisions versus
Right.
they classify for, I mean, it's exactly like insanity, like you're saying. That seems like a really tricky thing. Any thoughts there?
Well, I think it's important to recognize that not all cases are insanity cases. You bring up an interesting point because I have a case now, which I can't really talk about in detail, but she made some very poor decisions. And my job now is to make a determination as to, it's clear she wasn't psychotic. Okay, it's very clear to me she wasn't psychotic, but did she make those poor decisions because she had postpartum depression? Because we do know that postpartum depression can affect insight, it can affect judgment, it can affect impulse, it can affect decision making, right? So now my job is to make a determination. Okay, do I have enough information here to substantiate a diagnosis of postpartum depression, which then would lead to a reasonable conclusion that her behavior was the consequence of that. And if she hadn't had postpartum depression, she might not have acted in that way.
Yeah. Yeah.
It's complicated.
Um, I learned about, I met with Brooke Laufer
Yes,
a
yes,
while
I
ago,
know her very well.
and she had described this law in the UK that is, it sounds like a full protection for moms in the first I think it's 12 months postpartum, and
Yes,
just is like a, hey, we're going to protect. This is a vulnerable time, and any
yes.
actions here. What do you think about that approach, knowing like the cases you've seen?
Well, I think it's a law that should be in place here in the United
Okay.
States.
Yeah. It seems like I feel like
I
let's
mean,
just follow their path.
I mean, this is another category of criminal behavior. And I don't know whether you're familiar with George Parnham, who is the counsel for Andrea Yates.
Oh,
And as a result of his experience defending Andrea Yates, has become, over the years, because that goes back to 2001, has
wow.
become an incredible advocate for women's reproductive mental health. But he talks about the fact that there are, that the illness is the perpetrator. It's not the woman, it's the illness that's the perpetrator of what
Yeah.
occurs. And absolutely, we need to change the laws because
Yeah.
this is a different category of criminal behavior.
It seems like the path is Massachusetts recently had a new bill to protect
Right.
women, from what I understand. Do you think that's the path, like state by state, trying to create protections?
Well, I wish it were federal.
Yeah.
Um, but it's interesting that you bring that up because that's one of the interesting challenges as an expert is many of the states use this McNaughton law that I spoke about earlier, but they interpret it differently. So
Hmm.
depending on what state I'm in, I have to think about the law differently. So it's
Oh,
not, these are not cookie cutter cases. Every case is individual, every case stands on its own. It's not enough to go in and talk just about, the symptoms of postpartum psychosis. And I think another thing that's really important, education is important, but I think it is so easy in our culture, and I see this even in my clinical practice, that we tend to merge the illness with who we are.
hmm.
You're
Yep.
not you're not your depression, you're not your anxiety, you're not your psychosis. It's not a measure of who you are as a person. And in the courtroom, the emphasis is on what she did, not who she is. And so we need to share the story of someone and who this woman is to show the aberration in behavior, that this is not a measure of her.
Yeah.
Something went terribly wrong that resulted in illness. And it was the illness that was driving the behavior, not the woman.
Hmm.
And that's a real, I mean, I think if there's any obstacle in the courtroom, that certainly is one of the main obstacles, is that juries tend to identify the behavior and the woman as one. And we need to
Hmm.
tell her story in addition to educating about these illnesses and how insidious they are.
I feel like part of that is in the way the media talks about these sort of cases and being
Yeah.
like, this mother like is evil or like sensationalizing it in a way that I guess maybe sometimes they are like sharing more context about the abnormality of the situation. Yeah, I'm
Well,
wondering how
sometimes
that
the
plays
media
into
gets
it.
it wrong. Not always, but they do get it wrong. And when they get it wrong, that really affects public opinion.
Oh, yeah, and
I
that
mean,
could play into a jury.
and I know I'm not alone in this. Many of my colleagues I know have experienced this as well, where postpartum depression and postpartum psychosis are confused. And it's used, postpartum depression is used as an umbrella term.
That's what I was told in my inpatient experience. It was like, you are experiencing something under the umbrella of postpartum depression. I
Yeah.
was like, this doesn't feel like
Nope.
depression.
No. Yeah.
Okay. So we talked about a few things: state approaches to interpretation of law, juries' perceptions of the woman. What other factors play into how a woman would nav or go through the legal system?
Well, I think we've covered the primary
Okay.
challenges. uh, is really getting people to understand, we just don't have the mental space to understand that you could be so ill that you could, I mean, it just defies our, the way we, kind of navigate through life, right? I mean, it's hard to understand. It's just hard to understand that somebody could be so ill that they would act against their children in these ways.
Yeah, I think it goes back to what you were saying earlier, this idea of what motherhood should be and what woman should be in motherhood. It's like, oh, it's such a happy time, it
Yeah.
means for celebration. And so when an experience is so contrasted to that expectation of society, it's like, no, this doesn't fit.
I mean, it's almost like we have to rewrite the societal mythology so that because we have no space to tolerate the darker sides of motherhood, the frustrations, the rage, the ambivalence. We just don't have the mental space for that. Most people don't have the mental space for that.
Yeah. Yeah.
We defend against it.
Yeah. Um, I think also just knowing like I had no idea, I had no awareness of PMADs other than depression. I had heard of postpartum depression, but I imagine in jury situations, if people also have never heard of these things before, they're like, what is this excuse? Like, what are they
Right.
trying to
Yeah.
come up with to
Yeah.
justify this
Well,
crazy situation?
it's so interesting because I had a very high profile case in Ohio. Actually, it's part of a documentary called Baby Doe. And the prosecution, in an effort to discredit, it's about unperceived pregnancies. And in an effort to discredit my testimony, kept calling it a designer defense, that it was manufactured for the purpose of testimony, doesn't exist, even though we have tons and tons of research on this.
Whoa. A quick note about this documentary, Baby Doe. It follows the story of Gail Eastwood Ritchie, who had an unperceived pregnancy. This was before she got married and had a family. Gave birth to this baby when she was suddenly in labor and left her newborn in the woods. So it wasn't until decades later that there was the technology to, find the DNA and link this baby to her, and so now, years later, she is, going through the legal implications and facing threat of life in prison. So it's a complex story. It looks interesting. I will include a link to the show in the show notes. Let's get back to Dr. Barnes' reflections on cases of postpartum psychosis that she's covered over the years.
What's interesting to me is that sometimes the cases that you think or that I think, oh, this is, they're generally argued as insanity cases. But I've had experiences, actually, about 3 years ago, I had the experience. It was one case that I thought, I don't know, this is a tricky case. There were a lot of bad facts. I mean, no case is perfect, right? Every case has its bad facts. And it's a question of how do I, as the expert, or how does the defense attorney navigate, those bad facts. But every case has its bad facts. And I had one case where I was very clear that she had postpartum psychosis, that this was an insanity argument, but there were some bad facts that I can't even recall at this time. And I thought, I don't know. I don't know. This is going to trial. I know this is going to trial, and I'm getting myself all prepped. And about 2 weeks before they were going to set a trial date, the attorney came and said, they stipulated, well, it's not settling, but it's what they call stipulating, meaning they agreed based on my report, not guilty by reason of insanity, which meant in the state of California that she was going to be remanded to a psych facility for treatment.
Oh, amazing.
Wow, right? I had another case at the same time that I'm saying this is a slam dunk. There's no way. This is an insanity case if I ever saw an insanity case. It was like out of a textbook.
Uh-huh.
And we're getting closer and closer and closer to trial. And I literally had a trial date. And about a week before, the attorney came and said, "You're not going to believe this," but they stipulated based on report alone to not guilty by reason of insanity. So it's
That's
baffling.
amazing.
It's wonderful and it feels great. It doesn't always happen.
Yeah.
Those are the rare cases. One would think from what I've just told you that insanity cases frequently succeed. They do not. I think they're used in about 1% of cases and they succeed,
Oh.
I don't know what percentage of the time. Unfortunately, they're not generally a successful argument.
Oh. Okay. So most of the time it would go to trial.
Most of the time they go to trial. And I've had cases where it was so clear to me that this woman was psychotic and she went to prison. And in the state, I would say, generally speaking, these cases are considered what we call first degree murder, meaning murder with intention, premeditation, and women are
Oh,
looking at 25 years to life.
wow.
Yeah.
Okay. So
We had a
that's the other
very,
outcome.
yeah. You talk about, Megan, about the things that people don't understand in the courtroom, whether it's a jury or a judge. There was another documentary that was made about a high profile case here in California back in 2014.
Okay.
Carol Coronado, she had taken the life of 3 young children under the age of 3.
Wow.
It was a bench trial, which was probably a mistake, probably should have been a jury trial, but it was a
What does
bench
bench
trial.
trial mean?
Bench trial means just before a judge, no
Okay.
jury.
Oh, got it.
Okay. And the judge had no understanding of, I think there were a few shortcomings in this case. One was that the judge was biased and really had no understanding of
Oh,
um, how ill a woman could be and pointed to things that she did as proof that she was sane when in fact they actually were indications of how psychotic she was. And she's now in prison for natural life without the possibility of parole.
wow.
Yeah. And I think another shortcoming was that not enough attention was paid to who this woman was. I talked about too much emphasis on what she did and trying to explain what she did within the context of understanding postpartum psychosis, but that's only one small piece of testifying. The other important piece of testifying is telling the story of who this woman was, because she was a
Mm,
loving mother, she was an attentive mother who had an extensive history of trauma in her background and was really ill.
yeah. That makes sense to contrast the assumptions that will be made. Are there any recurring warning signs or systematic misses that you see as you've gone through these cases?
Well, families have a high degree of tolerance for odd behavior.
Yeah, assuming the benefit of the doubt.
Yes, yes. And so very often, and I work most often for the Office of the Public Defender. And so I'm dealing with a different population of women. And these are women who often have extensive histories of trauma. In many cases, the families have been, some of their own family members have tragically been the perpetrators of some of that trauma.
Mm,
And
yeah.
so I recognize that, I often look at some of these cases through a different lens because I've been so steeped in working with the Office of the Public Defender for so many years. But in many of the cases, things are overlooked because families are not educated or knowledgeable. If you would ask me, one thing we need to keep talking. We need to keep talking about this because it destigmatizes it. It makes it real. Postpartum psychosis can be scary, be
Yep.
very scary, as you know.
Yeah.
And the more we talk about things, the less scary they become and the more understandable they become.
Yeah.
And it requires stepping into the mind of a mom who has psychotic illness to understand what she was thinking. Because if you can step into her mind, then what she was thinking makes sense. And I often say that postpartum psychosis has a logic all its own. And if you understand that logic, it makes sense.
Mm. Mm. In your decades of experience supporting moms in their reproductive years, how do you see long-term impact playing out?
It's interesting that you bring this up because I actually have someone in my practice now who was arrested because she was in a manic state. She had postpartum psychosis, and she spent a night or two in jail, in a jail that I have actually visited. So I have personal experience of knowing what she experienced. It's a just, I mean, any jail is a horrible place, but just gives me chills that she experienced that.
Yeah.
And there's a trauma that results from that. How could there not be? And so
Yeah.
a lot of our work now is really making sense of what she went through and trying to piece together and understand her own illness at the time.
Yeah. So for those survivors of postpartum psychosis who are through it but still wrestling with the repercussions, how do you approach that? What do you say to them?
Well, I think it's probably less about what I say to them and much more about the experience of grieving, mourning, processing the loss, dealing with the trauma of what they experienced and how they've put that together for themselves, and being able to separate out the illness from who they are as a person, you know. Um,
Yeah.
I have a couple of women in my practice right now who had postpartum psychosis with a first child, are now pregnant and wanting to make sure that they
Yeah.
don't have postpartum a relapse with a second. And so putting a treatment plan in place, which might mean, how do we support sleep? Who's your support network? What medications are indicated? Referral to a reproductive psychiatrist, self-care plan. So putting all of that together to reduce the risks. But, postpartum psychosis occurs in only 1 or 2 out of every 1,000 women who give birth. So it's less common than other kinds of depressive disorders, but it's real and it exists. And if it's happening to you, it's terrifying.
Yes, it is terrifying. And it's helpful when you find the provider who understands it. With that in mind, if you were talking to clinicians or therapists who are kind of expanding and wanting to treat PMAD, specifically postpartum psychosis, what guidance would you offer?
Oh my gosh, that's a lofty question. I guess when I think about, and I think I'm fresh off of seeing some people yesterday where what came up for, interestingly, for both of them was grief. And not because of postpartum psychosis. We're just talking about postpartum depression
Okay.
and grief and mourning for the discrepancy between expectation and reality.
Hmm. Yep.
And really recognizing that we can be thrilled about having a baby. We can love our child so much and still be grieving the life that we had. And that they're not in conflict with each other, that two things can be true at the same time, that we can be in love with our baby and still be wondering what happened to me. I think of this kind of transition to motherhood, to parenthood, as a metamorphosis. And one of my patients yesterday, she actually used the language without my even using it. And she talked about feeling as though she had one foot in one world and the other foot in another world and
Hmm.
trying to bridge the gap because there is a sense of evolution of self in motherhood. Who am I now? Who was I? Who am I now? And trying to figure all of that out.
Yeah. Yeah. Have you noticed? So I think therapy is something that should be involved for everybody touching postpartum psychosis, or I mean PMADS, but like my partner did therapy, I did therapy. I'm thinking at broader systems for the recovery period. What advice do you have for partners and families for what helps everybody in the recovery?
Well, I think it's important that we recognize that partners and other family members are also having an experience. And I often work with the couple so that the partner has an opportunity to talk about their experience and what that's been like for them. And I think that there's a lot of healing that goes on with that.
I do too. I think gotta talk about
There's
it.
systems, everybody is affected.
Yeah.
Everyone is affected, not just the
Mhm.
new mom.
I love hearing providers talking about thinking about the family-wide needs and looping in partners to discussions about therapy and processing together. Now let's hear Dr. Barnes reflecting about her time as president of PSI in the early 2000s and some of the evolution in the advocacy space since.
PSI, it was a different world back then. It's so heartwarming to me because I've been, a part of the PSI family since like 1994, 1995.
Wow,
I have been
yeah.
to every single conference
Really?
except one.
Wow.
Yes. And that was during COVID. I had some family losses during that time, and so I wasn't able to
Oh,
go.
sorry.
But I've been to every single conference.
That's
Um,
amazing. That's
and it's
wow.
just so heartwarming to me because I'll just share with you back in like 2002 when I was president, if we got 100 people in a room, we used to have our conferences in Santa Barbara, which was the home of the founder, Jane Honickman. And so we used to have our conferences there at this beautiful retreat center in Santa Barbara. And if we got 100 people in a room, we were so excited. And now when I think about 1,200 people coming to a conference, it's just amazing to me. And, heartwarming, it brings tears to my eyes. It really does. I'm thinking of my father, who was an incredible champion for me.
Oh,
And my father had a saying. He used to say, if you get lemons, make lemonade. And just to watch PSI and the growth and the advocacy and the energy and the enthusiasm and the change that has occurred and is occurring on a daily basis is just amazing to me.
yeah. I think that the making lemonades out of lemons is so true because it's like these people have personal experiences and this is that energy. Like I want to
Yeah,
do good with something that was really hard. And so I
yeah,
love that
yeah.
phrase.
I mean, you asked me early on, what drove you to do this, and I think it's the kind of the adage I've lived by in my life. If life throws you lemons, make lemonade.
Yeah. I love it. I've seen it in the stories I've heard. It's like human resilience in
Yeah,
action.
yeah.
If you have this mentality, it's incredible what people can do from
And
really terrible situations.
and it's also interesting because, and maybe because I'm just so steeped in this particular, specialized space, but among patients of mine who experience recovery, many of them say, I want to go on and do something. I want to become a mentor. I want to get
Yeah.
involved. I want to be on the warm line. And it's really remarkable to me the wanting to give back.
Hmm. Yeah, and some completely changing their
Yeah.
profession and
Yes.
their direction in life.
Yes. Yes.
Yeah. Yeah. It's amazing. What are your thoughts on collaborating globally? I know that PSI is an international foundation. How do you see us leveraging learnings across borders?
Well, I actually am a member of the International Marseille Society, and I am the chair, the current chair of the Special Interest Group on Forensics and Maternal Mental Illness. So
Oh,
we have members from South Africa, from Austria, from Italy, from Asia, from the UK. And so we are in conversation monthly, collegially, about ways of, kind of global exchange of ideas and research. And
amazing.
yeah, yeah,
Oh, hooray. I'm glad that that is happening and existing.
yeah.
Is that focused on sharing research? Like, what is the core?
Well, we do different things. We do case presentations. We share research next month. And you do need to be a Marseille member in order
Uh-huh.
to attend a special interest group. But next month, one of our members, Claudia Clyer, who's a very prolific international researcher, is going to talk about some of her latest research. One of her areas of expertise and special knowledge is unperceived pregnancies.
Okay.
As a matter of fact, that's a language change that has happened within our own group, in our dialogue and conversations.
Made that
So
happen.
very proud of that. So we have presenters, we discuss research, we do case presentations. Yeah,
That's great.
yeah,
I'm glad to hear about that. And I've heard about, and I think I saw, I've come across the Marseille Society a few times. And so I love hearing
that's
about
really
that.
the research arm of this work.
Yeah. Yeah. Okay. If you could design a policy or cultural shift to improve outcomes for families, what would it be?
Oh my gosh, why don't you ask me the easy questions?
Yeah.
I think, I don't know whether I have you know, a good enough answer for that right now. But what I will say is we need to keep talking. We need to keep educating. We need to keep this conversation going. And we need to rewrite the societal script.
Hmm.
Just culturally, we need to rewrite the societal script.
Do you mean primarily around mothering and
Yes. And the
expectations?
challenges,
Yeah, holding multiple feelings and truths in the same experience.
absolutely. Allowing many things to be true at the same time.
It's funny because I feel like this is a skill I have been working through with my kids, my young kids, being like, so like my youngest got her ears pierced 2 days ago.
Woo!
And she was so nervous and so excited.
Yeah.
Like
Yeah.
in the same moment, she was like, Mom, I'm so scared and let's do this. And it was like, that is such a human experience. Like you
Right.
can be many things at
Right.
once.
Right.
But then somehow culturally, we think something is one thing,
And the
right?
confidence actually comes from being nervous and doing it anyway. And that's where the confidence comes from.
Yeah. Yeah. So maybe, yeah, maybe some shifts just happen young, like a
Yeah.
helping coach that, you can
Yeah.
have many feelings in one experience. Like it's
Absolutely.
okay. What resources would you point families who have been impacted by postpartum psychosis?
Well, certainly I would turn them to PSI and, the Postpartum Psychosis Survivors Task Force.
Uh-huh.
Here in Los Angeles, we also have a local task force called Maternal Mental Health Now. That's a wonderful resource for people who live in LA or in
Okay.
this regional area. But yeah,
Amazing. Okay. And then resources for families who are navigating legal systems. Is there any?
well, PSI also has a legal advocacy group. So I would point them, PSI covers it all. If you write to the office, you can get through to the legal advocacy.
Okay, and they support what's the support that they
Well,
provide?
they'll refer you. I mean,
Okay,
I get a lot of referrals from them, but
through
they'll
PSA
refer you
to
to
experts who can.
experts who can
Got it.
make themselves
Okay.
available for consultation. So I
Yeah.
would point them in the direction of PSI. I would also say to families that, you know, These are cases that really do require expert evaluation. Cases that don't have an expert are generally, I mean, I can't give you, statistics here, but these are hard enough cases to begin with, and it really requires expert evaluation.
Okay, that's a wrap for today's episode. A huge thank you to Dr. Barnes for sharing her experiences and wisdom from the many women and families she's been able to support over the years through PMADs and some pretty challenging experiences. I will include a link to Dr. Barnes' private practice if you would like to reach out or see what services she offers. She does psychotherapy and expert witness support. I also have the research and resources we've mentioned, including the Baby Doe documentary, in the show notes. Thank you so much for listening to Mom Breaks. If you know someone who might be interested in this conversation, I'd love it if you would share the podcast with them. And also, if you haven't already, please subscribe on whatever platform you tune in with. Thanks for being here, and until next time, be kind to your mind.